Good morning, Nevada. This is Tina Drago and Jim Godwin coming to you with Healthy Nevada. Jim, tell us about our guest today.
Tina, I would love to. Our guest today is my colleague, Brandi Johns. She's a Member Services Coordinator at Nevada Primary Care Association, which I just crossed off one of my questions. What is your role at NVPCA? I already knocked that one out of the park.
Oh, we could ask her all kinds of personal things.
So, Brandi, what do you do? What does Member Services Coordinator entail?
Well, good morning. I help recruit new members. I help support them with their needs and any questions they have, and then most importantly, help with any training for any of the health centers.
So by new members, do you mean new health centers that are nonprofits?
Yes, correct.
Okay, excellent. And are you having any luck with that?
We have a few health centers that have joined lately, a few new ones in Vegas.
They're all over the place, aren't they? I'm glad to hear that.
Thanks.
So as a quasi-new, I'm 3 years old, health center, there was just a ridiculous amount of information and no clear path as to, you have to get credentialed to take insurance, and you need to do this, and you need to do that. But there was no clear path back in the day, 3 years ago, when I started. Is that what you are providing these health centers that are looking to aspire to federally qualified, or at least a patient center or a community health center model?
Tina?
Yes?
I hate to interrupt, but I think lots of information with no clear path pretty much describes most modern-day life in America.
Well, yes.
Okay, sorry, now I'll stop this. Okay.
Yeah, that's what we're working on. We're trying to set up more ways to have it a little clearer for the new health centers. I know there's so much when you first start up, but trying to make that up clear. I know we do a lot of things on trainings on quality and risk management. We do patient-centered medical home training, payment reform, compliance and operational site visit trainings, UDS training. We even do preventing provider burnout and emergency preparedness.
I would love the emergency preparedness down in Las Vegas, where we're located downtown. It's funny, but they go through the sewer system and stuff like that. Our whole clinic is paperless and digital. And when they send these little robots through the sewer system, it takes our system down because they're remote control. So they piggyback on our Wi-Fi.
Oh, why are there robots in the sewer?
Because the city's, kind of old and we have drainage issues. Las Vegas is kind of on caliche. So anytime there's a crack in the sewer lines or there's a clog or some kind of repair issue going on, they send down robots to look at it first.
Oh, I think I remember reading about these poo bots.
Well, these poo bots really affect our clinic. So what I've ended up having to do is go to cellular hotspots and stuff so that we can stay online. Wow. Yeah. So,
Interesting.
That is interesting.
So it is kind of funny that it's those little things, and we're in the heart of downtown Las Vegas, and then we get our telephones go down because of this. So that's just my emergency preparedness program. What? Go on, Jim.
Oh, you go on, Tina.
So I was going to say part of the program is you give them kind of like a 1-step, 2-step. This is where we need to be, and kind of a general outline so that they can develop these plans to fit their personal mission and values.
Yes, exactly.
Excellent. Do you have people? I would think you'd be the most popular girl up there at the PCA with all the information.
Well, I just recently started taking over the training part of it, so it's kind of a new area for me. So it's kind of fun to jump in and learn all this myself. So, so we definitely have the expertise here to help with all of this.
Yeah, you definitely have to know everything in order to supply. I mean, I know that when we were so excited about becoming an FQHC January that I didn't even realize that now I'm looking behind the wizard's curtain and there's a whole nother categories of things that we have to do. And so it was a whole nother learning curve that I think people don't really get until it happens. So I'm trying to scare the bejeebies out of them and beware of what you wish for, because it's a lot of work. Good work.
That's why we have Brandi Johns. When people are looking behind the curtain and they're a little intimidated, they just click together their red shoes and Brandi appears.
Are you coming down to Las Vegas, Brandi? Are you staying up in Carson City?
Oh, no, we'll be in Vegas a lot. I'll actually be there next week.
Excellent. I look forward to meeting you.
Yeah.
And can you also tell us, Brandi, some other reasons why trainings are so important?
Yeah, first of all, it's a big part of MVPCA's mission as a primary care association to help provide our members with timely and leading edge training, because the healthcare environment is constantly changing, and so I always want to stay on top of those things and make sure that our health centers have all the up-to-date information. So we do a variety of trainings throughout the year, and we also co-sponsor trainings with federal and state organizations as well.
So and I know next week is a risk management training, correct?
Yes, next week is our Federal Tort Claim Act University, and that will be in Las Vegas, the 18th and 19th, and that is a training that's provided by HRSA. And it should be a really good one. I'm pretty excited about it. It's got a lot of great information.
I don't think the average person really understands how much training and how much quality assurance and policy and procedure guidelines federally qualified healthcare centers actually go through to provide the patient with comprehensive care plans and workarounds that meet their individual needs. Much different than the Dr. Welby days of say, and let me see what I can do for you. I mean, there's a whole network of people and systems that actually help patients now, especially our most at-risk patients. Mm-hmm. And part of that, and I think part of that is the appreciation of knowing that quality is a living organism within our organizations, and it's always changing, like you said.
That's true, and it's also important due to anything in the healthcare world or anything governmental or in the world of academia. There's going to be a large amount of bureaucracy and a lot of rules that are in place in order to chart things and be able to track things. And I think that's another good reason for all of the trainings and to keep people up to date. Is do all these changes in the fast-paced society we live in and technology changing so much. A lot has changed since Dr. Marcus Welby was practicing.
Hey, I watched him as a kid, so I'm dating myself. So, Brandi, tell us about the layers of quality reporting and quality programs that a normal community health center or FQHC has to deal with.
Yeah, that's a hard one, Gina.
Well, okay, let's start out. We know that everybody tries to aspire for meaningful use, right?
Yes.
So, and then we layer on top of that like UDS measures.
Yes, and we do have a UDS training once a year.
And so, what is UDS?
Uniform Data System.
Okay, and why is that important?
I'm just going to pipe in because I actually know something. It's important because it's a good way of keeping track of all of your data and who you're helping and what you're helping them for. So that way you have data to see where you need to improve as far as diabetes or tobacco cessation or what have you. And also it's a good way to get those numbers to show the public the good that you're doing and how you are helping the community. And it's nice to back up those claims with nice data.
So unlike meaningful use, which is an internal quality control program, UDS data is actually open to anybody, right? So the government uses that data to actually correlate patient population needs?
Yes.
Yes, it does.
Thank you. Come on, Brandi, don't hold back. Jump in. So UDS is something that once you become a federally qualified healthcare center, your quality measures now become like public knowledge, right?
Yes. Which is nice to have those checks and balances to make sure everybody is doing what they're supposed to be doing.
And it also lets people know that FQHCs are not all alike. They each have their own personality and they have their own strengths and weaknesses too.
Exactly. One of the beauties, because they're mission-driven and community-driven, with a board of people from the community, they're all going to be slightly different due to the population they're serving and what the community is comprised of and their geographical location. So many variables.
So I'll give you an example. Like our FQHC downtown is really, our kind of niche is diabetes, hypertension, obesity, because we're addressing a poor population, a vulnerable population that doesn't have access to everything that they may need to have a healthy lifestyle. But maybe out in the west side of town, the FQHC might really focus on cancer or behavioral health issues. And that might be their real niche area. So when you're looking for an FQHC, you should also, do your homework and look at what their strengths are. Right, Brandi?
Yes, correct. And we definitely here in Reno have one that focuses a lot on AIDS programs and needle exchange and things like that as well. So that's definitely correct.
Yes. So
each health center is a little different. And focuses.
And that's the best part of these community health centers is that they are a little different in each area and they do have their focuses so people can get what they need.
That's right, and that's what combined the community health centers can provide a holistic system that kind of takes care of everything by each focusing on their own niches or niches.
I like the idea in Las Vegas. We have a couple community health centers, and like one of them is strong in obstetric and pediatric care, and some of them are strong in geriatric care and reducing medications for our elderly. So those are areas also, and the UDS captures all that data.
It does.
Okay, excellent. And then we layer on top of that another quality report because meaningful use in UDS just isn't enough anymore. And that's where we go with patient-centered medical home, correct?
Correct.
And so when somebody has that seal, that patient-centered medical home seal, how like wonderful are they?
I think the patient-centered medical home is a great program because it definitely looks at the patient as a whole. It's not just focusing on one need. They look at every need that patient has. They can get all their care right in one place, and they don't have to go to a bunch of different specialists. So I think it's a great program. It's a serious mind, body, soul, right? Everything's there. Correct. Mm-hmm.
Well, it's great. We're actually in the process now that we're a federally qualified healthcare center. We're in the process of getting our patient-centered medical home because it is inexpensive. It's like a JCO rating or an ISO rating where it's expensive to do unless you have the means to. Or the previous credentialing to move you up. So we're there now.
Nice.
What other programs do you have, Brandi?
Well, I did want to tell everybody about another training that's coming up. We have the 2016 Region 9 Leadership Conference, and we're doing that with Arizona PCA, Western Clinicians Network, and Nevada Primary Care Association. And that's on June 12th through the 14th, and it's transforming care to create value and maintaining your patient and provider relationship. And that is up in Lake Tahoe at Harvey's, gorgeous location. And that's, a good chance to interact with medical directors, dental directors, CEOs, anyone that works in the clinics. And that's for anyone in Arizona, California, Hawaii, and Nevada. And they expect over 150 clinicians, executive directors, and there's just a lot of great topics in there. We're doing some peer learning sessions around like the real world everyday leadership challenges. There is going to be some value-based care discussions, provider burnout, creating an incentive plan. There's some employee wellness sessions. So there's a lot of really great sessions for that too. So that again is on June 12th through the 14th. Excellent.
So this is an ongoing, so nobody should be expected to sit back once they get a credentialing. They're live, they're breathing, they're always changing.
Mm-hmm.
And tell us what PINs are. Do you know? PIN?
I'm not sure. Sorry.
Oh, okay. So PINs are actually updates that the federal government, HRSA, sends out to all the FQHCs. And they basically go, we know we told you we wanted it done this way, but we want to incorporate now A, B, and C into your process, procedures, and quality plans for, any particular area of your operation. And when you get those PINs, you need to figure out how to not only incorporate it, but capture the data and make your organization more malleable to meet the needs of growing that the government has asked for. So, they have this 2020 initiative and everything, and they want us to be everything to everybody for the patients, and they want the patients to be healthier. So they're constantly coming out with evidence-based or legislative changes that the FQHCs need to adhere to.
Exactly, which brings up another point that we've talked about in episodes past, Tina, about how, for instance, when I started working in the healthcare industry, changed my perception and my experience of any sort of doctor's appointments I have. I'm much more patient nowadays when I realize everything that goes on behind the curtain. It really has increased my patience, whereas before I would be, and now I just whistle and hum a tune.
I'm always explaining. I find myself like at least once a week pulling a patient into my office because they're not happy with the wait. And once I sit down and I explain to them, how many things go into just a simple office appointment, and that sometimes there's patients that are much more chronic than they are, and that, we want everybody to feel that their time is of value. And I just bring it down to a conversation. I'm amazed at how quickly people go, okay, I get it, and I want that same exact care when it's my turn. So I will be a little bit more patient, and I will come a little earlier. I will make sure my paperwork's done. I won't be, so snarky with the staff. And, and I think it is a conversation for people. They just don't know. They don't know what to expect. And, we have that. Nevada has such a poor reputation nationally about the health care that's provided that we're almost, we're an anomaly. I mean, I have daily patients go, I've never had a doctor be as thorough as they are with me. And that's a great thing to hear because we're doing something really well. But it's a sad thing to hear because they're 50 years old and they've had 50 years of medical experience and they haven't had a provider really give them thorough examination.
Mm-hmm.
So we're flip-flopping that all over the place. So, Brandi, you have anything else to talk about?
No, I think that's about it.
You're killing me, kid. So,
well, and also we just for the listeners, we've just been touching on the in-person trainings that go on. We haven't even touched. That's like the tip of the iceberg. With technology that we have today, there's a huge amount of webinars that go on and virtual trainings to keep you up to date on the latest policy changes. And let me tell you, my inbox is flooded with those because I'm the person that disseminates those to the community health centers of Nevada. And it is just huge. Every day, my inbox, I got 60, 70. It's a ridiculous amount of emails. And it's just try and keep track of everything that's going on and changing is quite an ordeal. So getting these actual in real life IRL trainings are a nice break from the virtual trainings because it allows you to network and be there in person and not staring at your computer screen. So Brandi provides just a wonderful service to everybody, really just the state of Nevada. I mean, if you boil it down, because it's for the community health centers, which helps out the people of Nevada, which helps out the state. So,
that is true, and there is a lot. There's constantly something to learn out there, and it is kind of a little daunting. And then you have to have one person that knows it all in an organization that disseminates it to everybody else, so they can all be on the same page.
It's a huge amount. So if anyone wanted to just take a peek at some of the trainings and agendas to see the amount of information being thrown around out there, Brandi, where can people go to find out some more info on these trainings and maybe some further details?
All of the information on our trainings will be located on our website at mbpca.org. There's a calendar there, and you can also register for most of these trainings from the website.
So that's NV as in Nevada, PCA as in Primary Care Association?
Yep.
.org. Got it. That sounds wonderful. Well,
How are we doing on time?
big long step. We got about 2-3 minutes left. So,
okay.
Jim, tell me something that happened to you this week. What's in your weekly calendar?
I don't know if a lot of people know, but May is Teen Pregnancy Prevention Month. So I have been doing a lot of work with the Office of Adolescent Health and our own teen pregnancy prevention program here at the Nevada Primary Care Association, which will be making its way to the community health centers of Nevada.
Yes.
And so there's a lot of ways that people want to go.
That sounds
a lot of
wonderful.
Information out there. Nevada ranks quite low in the country for teen pregnancy prevention.
Which means we have a lot of pregnant teens.
Yes, we do. Although Nevada's done a great job of lowering that number, we're still quite low on the list. So I've been doing lots of social media posts and a lot of links to different information.
Well, First Person Complete Care is now a school-based clinic at Valley High School that has 30 pregnant young ladies. And we're hoping that having school-based clinics and education programs right there on high school property. We're the first in southern Nevada. I know there's one up in northern Nevada. We're hoping that makes an impact as well.
Yes. Well, once again, I also like this show because it highlights all the awesomeness that First Person does.
No, you don't have to stroke
Making
us.
the world a better place.
One baby step at a time, right?
Yes, that is correct.
Yeah. You do what little you can do.
Yeah, so that's what I've been doing, and I just mention it because it's fun, because there's lots of fun images and graphics to include for teen pregnancy prevention. I've been using lots of pictures of goalies for soccer or hockey.
Blocking the goal, yeah.
Yeah, that's why it's a fun month for me. Be a little clever with my information.
Well, I'm glad you clarified
Do you have
that.
anything exciting coming up at First Person?
No, we had an outreach last week. We have 3 or 4 outreaches probably in the rest of this month, working with adolescents. We'll be at Catholic Charities doing a TDAP program and a cocooning program for the parents of young children. And just getting out there and letting people know our services. My focus right now is really opening up our dental facility over at Huntridge so that it's family oriented and not just for teens. And that's
nice.
Yeah, and that's where we're moving. We're just spreading our wings, and that's part of my exhaustion level.
Well, I applaud you on the emphasis of the dental care. A lot of people forget about the importance of that.
It's
as somebody who's had a double root canal.
Ooh.
I cannot stress the importance of going and getting that dental care, people.
It is so important. I mean, it's part of your body. It's one of the areas that bacteria and infections is the easiest to
exactly
to start.
It doesn't come to your mind often, but it affects your whole body.
Absolutely.
Because your body's just a complex system,
Yeah.
and it's all interrelated, just like a car.
Absolutely. So we're looking at that, and of course, we've brought behavioral into our facilities this last year, and we are now going to have it in June. We are going to bring it in as a full-time integrated part. So we'll have primary care, behavioral, and dental at First Person by July 1st. So
outstanding.
Just trying to make it all comprehensive because these are needs that people have. Yeah, so
that is true.
Well, I think that wraps up our show. Jim, Brandi, I really appreciate you coming in this morning, Brandi. And Jim, you're always a great guy. This
Wait
is.
till you hear my Dr. Phil impression.
Oh, goody.
Bust it out one day for the radio listener.
You'll bust it out for us? Okay.
Yeah.
This is Tina Drago with Healthy Nevada, coming to you from the Beasley Broadcast Studios in sunny Las Vegas. I hope everybody's having a happy and healthy day.